Hi, I'm Tom Gulch. I am the full-time EMS supervisor at Put-in-Bay EMS, and here at Mobile Care, I am one of the EMS instructors and also one of the paramedics. Today, we're going to talk a little bit about continuous positive airway pressurization, or CPAP for short. We're going to talk about what CPAP does and how it works. We're going to talk about when we use CPAP per protocol. We're going to talk about how to set up and apply the CPAP to a patient. We're also going to talk a little bit about the advantages and disadvantages, followed up by any questions that you need answered at the end. To start off, what CPAP is and how it works. CPAP, as I said, is continuous positive airway pressurization. It forces air into your airway and holds that airway open, also holds the airway in your lungs open, and forces any fluid out of it. We use CPAP here for pulmonary edema or hypertensive patients with pulmonary edema. There are many other uses for CPAP, such as COPD and asthma, but here we cannot use that because of the PEEP valve differentiation. CPAP for pulmonary edema uses a 10 centimeter of water PEEP, and it is fixed, non-variable, and that is why we can only use it for pulmonary edema. The CPAP used for COPD and asthma uses different PEEP values, so we would have to get a different value or have a variable PEEP valve on here in order to use that. In order to use CPAP on a patient, they must have pulmonary edema or rales or wet sounding in their chest. They must also have an open airway maintainable by themselves. They must be alert enough to maintain that airway. And they must be breathing on their own. If they're not breathing on their own, we can't use this also. And finally, their blood pressure must be above 100 millimeters of mercury systolically. The reason for that is CPAP will reduce the preload and afterload of the heart, and in turn will lower the blood pressure down. If it's not at least 100 millimeters of mercury systolically initially, then it'll drop too low and they won't be able to perfuse. You're going to put them right back in the same condition they are already of not perfusing and not having adequate oxygenation in their body. How to set up the CPAP? CPAP is pre-packaged, one-time use, disposable. It is single patient use. It comes with an air mixing valve to mix the oxygen and the air after it's being filtered, a convoluted tube to connect the system together, PEEP valve, and face mask and head strap assembly. In order to apply and set up the CPAP to use it, the only thing you really need to do is attach the PEEP valve to the front of the mask and then connect your oxygen supply. To connect your oxygen supply, you use a portable regulator with an accessory port. You screw your air mixing valve into your accessory port on your portable regulator and turn on your oxygen. Now you can hear the CPAP start working, you can hear the oxygen flowing. I'm going to go ahead and shut it off just for noise purposes and to conserve oxygen. This portable cylinder will last approximately 15 to 20 minutes with CPAP flowing, and that is actually a very generous estimate. If you're going to be anywhere near that, you really should connect the patient to the truck oxygen supply. In order to connect the patient to the truck oxygen supply, you take the flow meter and remove the Christmas tree. You then attach your mixing valve to the same port that your Christmas tree was connected to, and open your valve all the way until it stops. If you only open it until it reads 15 liters per minute, you won't have enough pressure and you won't have enough flow to operate your CPAP, and the patient will actually suffer from this. So you must open the valve entirely until it stops. Once the oxygen is flowing, you can apply the CPAP to your patient's face and make sure you get a good seal across the bridge of the nose and across the cleft of the chin. And these pads should rest on the patient's forehead. Once the patient has this in their face, you will then attach the head strap by placing it behind their head Bring the side straps around to the front and locking them into the front of the mask. Once the mask is secured to the face, you can then tighten the straps down to form a tight seal across the entire opening of the mouth so that no air is escaping. If any air is escaping, you're losing the purpose of CPAP. So it must be very tight, and it actually will look like it is mashing the patient's face. The patient may also need some other medications such as Lasix, nitroglycerin, Vasotec, or Captopril, but those are paramedic administered drugs. The CPAP can be administered by anyone, whether it be EMT basic, EMT intermediate, or EMT paramedic. A patient may also need a little bit of sedatives such as Versed or Valium for the CPAP, just because it is an odd feeling with it attached to your face. Some advantages and disadvantages of CPAP. The advantages are actually work together with each other. They reduce the need for intubation of a patient, they reduce the length of hospital stays, and they reduce the chance for infection. And the way these work is, a patient that's placed on CPAP will turn around much more quickly so that you don't need to advance this step of intubation. Once you do advance that step of intubation, the patient has a greater chance of a longer admission to the hospital. And then the admission can even be extended more because it's very difficult to get an intubated CHF patient extubated. They become so reliant on that tube that they cannot get it, they can't take it out and the patient stay oxygenated properly. And because you're reducing their hospital stay and reducing the need for intubation, you're also reducing the risk for infection because you're not introducing a foreign body into the airway and you're not maintaining them in the hospital longer than they need to be. Some disadvantages of CPAP is if the patient's not breathing or the patient is not alert enough to maintain that airway, you're not going to be able to use CPAP. And also if their blood pressure isn't high enough, if they've been in CHF or have pulmonary edema for a long period of time already, you won't be able to use the CPAP. You will have to go directly to the intubation. Any questions? Thank you very much.